So that was like pre the pandemic, no? But yeah, so now we've been, I don't know, how long have we been on ECQ stuck in our homes?
6 weeks.
With how long na?
6 weeks.
6 weeks?
Six
Yeah.
weeks na ba?
Yeah, we're the
Dali ano?
We stopped seeing patients in the clinic about March 15.
March 15.
We were very early to stop seeing patients. Yeah, March 16.
So how does that kanang so right now, so so like never mind like you guys, but like generally speaking, like like there kay I I'll be honest with you, like me in my head ba, before this, like I don't know, while this pandemic was happening, my thinking was more, oh, I guess all doctors still have to go to the hospital or yeah, kanang help out with this whole thing. But then I realized, wait, not everybody is kanang specialized in that mandiay. So like you guys, you know, obviously your specialty is very different from, what's happening with the coronavirus, that sort of thing. So what is the situation now for a lot of doctors and patients?
So basically, some of the doctors who are not called as a frontline good, we are mainly seeing patients na what we call elective. These are not emergency patients. So, of course, pain is urgent, but it's not emergent. So, currently, we have also a very good number of doctors who are catering to these patients. And so far sa Cebu, atong situation karon, we are not at that point that we have to go on duty. In some other countries, the orthopedic doctors are already on duty, being internal medicine doctors, checking cough and colds. But luckily, sa Atoa, we are not in that situation yet.
So we're not overwhelmed yet. We're not at that point,
No,
pa.
no, no. So definitely we're not like Italy. My friends in Italy, they told me the orthopedic and spine doctors, they're going on duty as ER doctors for cough, for cold, for pneumonia. So that's a very bad case already.
So like kada, so in many ways we're kind of fortunate pa here nga murag it hasn't really, yeah, like Italy it really exploded, 'di ba? When
Yeah.
yeah, like currently in New York, I believe that sort of thing, like they're getting swamped, no?
Yeah.
So like for you guys, nga you haven't had to uh kanang we're not at that point yet. So how has it affected your practice? So aside from not going in since March 15.
I think across all subspecialties or specialties, a lot of patients don't really go to the hospital or to the clinic unless they feel it is really necessary because they don't want to get infected. For a time, a lot of the clinics in UC Med, in Chonghua, that's when you go to the medical arts building, it's a ghost town. Nobody's there. No patients, no doctors. And even if there were a few doctors in, there were no patients because the patients, they don't want to go to the hospitals anymore. So unless it is an emergency case or the pain is really very bothersome, then that's the time that they go to the clinic. So I guess this has affected us in that even if we did stay in the clinics, we're not going to have a lot of patients anyway. So that's why we have to adapt to patients. We can see them with their complaints without having to go physically in the clinic or meet them face to face.
So sige, let's talk about that app. So like this is all, so there's a term that I just saw and reading a little bit about this, the telemedicine. So is that what something that you guys have started doing, or what is telemedicine exactly?
Janjay can give us an idea.
Oh yeah, so Janjay, you can introduce yourself. Yeah.
Hello. Good afternoon, everyone. Sorry for being late. I'm John Jay, the president and CEO of Synapse Inc. So we are a company that we are a software development company that specializes in creating software in the medical field. So just to backtrack a little bit lang sa giingon nilang Dr. Pierre and ni Dr. Claire is that we also know that because they are orthopedic surgeons, there are also cases that that you mentioned that they really need you to go to the hospital to operate on their patients. Diba, Doc? Is that correct?
Yeah,
Yeah.
we
So
do some surgeries every now and then, but very rare compared to pre-pandemic.
yeah. So kana lang just want to air that out and give appreciation for some of the doctors who still go to the hospital where it's very risky for them just so that they can treat the urgent concerns of their patients. So just wanted to say that. And back to the question regarding what is telemedicine. Actually, I don't want to say it in my own words, so I'd like to give what DOH is officially describing telemedicine as. So, excuse me, as per DOH, let me check my codigo. So, telemedicine refers to the practice of medicine by means of electronic and telecommunications technologies such as phone call, chat, SMS, or text, audio, and video conferencing to deliver healthcare at a distance between a patient at an originating site and a physician at a distant site. So mao na siya ang official nga definition sa Department of Health on what telemedicine is. So basically, we are communicating with our doctors, kami as patients, nga the same way nga we communicate, most of us communicate karon using online and social media, ng technological nga means. Pero ato lang na siyang gi-apply sa medical nga setting, especially as a way to connect with our doctors nga not nga dili gyud kami physically present face to face with the doctor in their clinics. Yeah, that's basically what telemedicine is.
So you have a platform that does this, that makes it easy for the doctors and patients to connect to each other, diba?
Yes, so since we launched our program, it's called CloudMD. So even before the crisis, pre-COVID pa, around 2015, 2016, if I'm not mistaken, Rich, we were one of the first few companies to pioneer the practice management system. So basically, it's called an EMR, electronic medical records nga system, wherein ang mga clinics nato ato gyud basically gi paperless. So gi-digitize na to ang process flow sa doctor sa ilang clinic na setup. So long story short, when the crisis, when the ECQ was implemented there sa Cebu about a few weeks ago, that's when our company decided right away to add a module into our system called the e-consult module or the telemedicine module. Kay we know that ang clinics non-operational karon, a lot of like what doctors Pierre and Claire said. So we were put in a position to be able to at least support the doctors through technology so that they can still continue seeing their patients and hopefully maka-save good sila life. So basically support system lang gud mi nila. So
This is
that's
Cloud PX, diba, bay?
yeah. So CloudMD, the ecosystem is na siya duha ka parts. So CloudMD, it's the portal for the doctors. So that's where the doctors document their interaction with their patients. And the past 3 weeks, so mo to mong develop the patient portal called CloudPX. So it's a way for the patients to look at to search for a doctor or their doctors in our doctor directory and then book an appointment request with them so they can have an e-consult session through video, audio, and chat through our platforms na. So that's where CloudMD and CloudPX meets in the middle.
So yeah, my understanding of CloudMD was a way for like doctors to keep records, diba? Like kanang prior, I guess prior to that, it used to be just Yeah, kind of like you put it in a notebook or a piece of paper. There's a folder, and yeah, this is the patient's file. And yeah, it used to be
Pull it
quite
out.
tedious, I assume.
Yeah, our secretaries will just pull it out every now and then, and sometimes they get lost. Or if the secretary is not around, then I will have to personally pull out the file, which sometimes or most of the time I don't know how she arranges all the files, so I get messed up. So that's when we met the group of Synapse, where way back 2017, and we implemented paperless, me and Claire.
Yeah, in terms of keeping track of everything, I assume it's so much easier. I mean, even for the patient, like me, I'm looking at it from the patient's point of view. Like, I assume, for example, I go to a different doctor, and then they're plugged into the same system. Is there a way for one doctor to send the records to another doctor, or
Mr. Godless can answer that.
All right, so right now there isn't a way where you could do that directly. However, we are working on a module that allows doctors in the near future, very soon, to be able to do that. It's just that there are some things that we need to take care of from the back end, as far as making sure that um, the way you send it and the way you package it and the way you protect that data when it's in transit from the original or the performing doctor to the referral doctor is secure. We just don't want to end up in a situation wherein, in between that transition or in between that sending, it can be intercepted or the data can be breached. So before
I see.
having to, just being able to make sure that we can secure good the data before we make it available for every doctor to use. Yeah,
But no, that's tricky. There's privacy concerns when they said you're doing
that's
that,
right.
no?
That's right.
Ah, but I assume like kinda it's so much easier for doctors to keep track. So you guys are using that system. When yeah, as a module of that system, you have the Cloud PX, correct?
Yeah. So
So,
Cloud PX is basically it's a standalone platform, but it's what it does is it communicates directly to Cloud MD. So before all this happened, there wasn't really a Cloud PX, no? We were scrambling very quickly just to create that entire platform so we can offer it for free na lang to, at least for people who want to start using it. But as Janjay mentioned earlier, before this all happened, the ECQ and the pandemic, CloudMD was first meant to be a system for doctors, where it would be easy to retrieve any records and manage their entire filing system digitally. Yeah.
yes, I tried logging into the
Tama ba?
Cloud PX. Yeah, it looks cool,
How'd you
man. Like
find it? Was the experience very
well, I
easy for
did.
you?
Yeah, I felt like it was pretty easy. No, I, I in fact when I went on it, I saw. I think I had a batchmate who was one of the doctors there. Yeah, I did everything except get
Book.
a consultation. Kay mo sa
Free
just
man
trying it
tayo.
out, ma'am. Huh?
It's free batchmate man.
Ayun, yeah, so, haven't spoken in mga 10 years ba? We're, uy, may, basta.
Best time to reconnect ka ron.
No, but I'll be honest with you, I was surprised. Like it was very intuitive ba? No? Um and then have you guys had I didn't realize that it was only up for 3 weeks.
Yes, around
Uh,
that time. Yeah.
about a week back, the 3 weeks, the first 2 weeks is where we scrambled to develop it. And so we formally launched it actually last Friday pa na mo siya gi-release to the public officially. Okay, we wanted to make sure yun nga ang quality niya, the problems with the issues with the user interface, the user's experience nga na-iron out yun nato, and of course the security. Kay I think that's a very hot topic karon kaning panahon na, wherein all patients, doctors, and government agencies are really scrambling to find a solution lang which is not yet vetted by the government, which is not perfect, but because of the situation, I would say that it is better than nothing. Na at least nagyud tay mabuhat na lang in response to the crisis. So those were the things that we are really sensitive about, especially when you mentioned ganina, Carl, nga about data privacy and security. So mao gyud na siyang among number one priority karon kay our system needs to be safe for all doctors and patients as well.
Yeah, well, aside from security, I mean, me personally, also I was thinking about it because I've been thinking a lot about basically the new, this whole thing right now, but with this whole pandemic, and then as Pierre mentioned, there's the vaccine is not around, and it seems like, correct me if I'm wrong, Pierre, the vaccine is probably going to be at least a year away.
Yeah.
No,
And
it's like a long time.
it might not work for all the types of strains. So you might have the vaccine for the strain that will probably really kill you. Itong morbid type of strains, basin there will be no vaccine available, and it's mutating every now and then. So you can't really say.
Yeah, well, Mona, because I was just listening to a podcast, and they were explaining how vaccines are made, and the guy was like, if all goes well, which doesn't happen, he
Yeah,
said a year.
yeah,
So, and I guess kind of that's the reason why kind of mutations, different strains, that sort of thing. Uh, so like for all intents and purposes, all of us in the world are kind of stuck in this kanang new way of living somehow, no? Because even after they take away the ECQ, there's gonna be some level of social
distancing.
distancing and everything, right?
Yeah,
Hopefully, Pierre, makabike ka balik sa side.
yeah. Dapat lagi lang.
Stay away, mga 20 feet lang tinali.
Ay, sige. Pastas lang kang bike, right? Okay lang.
Uh, timing ra to. So, so I was thinking like this will be very useful good for a lot of people. Like the, if you, especially moving forward, there will be a lot of unnecessary risk just going out ba, no?
Yeah.
Assuming with the whole social distancing thing, and then of course you go to a hospital, in a way there's some unnecessary risk there. Like me, I would like to, if I have something wrong automatic, I would like to find somebody that I can call. And in many
Yeah.
ways it seems like a lot easier because I went to the app, and then I think you could see the different names of the doctors and then their specialty. Is it
Yes, their
correct?
specialty.
Am I
That's correct.
remembering? Yeah. So as opposed to walking around the building looking for the room ba, no?
Yeah.
Uh,